So we are going to look at the blood supply to the central nervous system. We must know where the blood vessels which supply the brain come from. And I want you to pay maximum attention and observe carefully. So all of you pay attention and observe. This is the arch of the aorta. On the right, it gives off what we call the brachiocephalic artery. That is on the right. It gives off the brachiocephalic artery. Then the brachiocephalic artery divides into the right common carotid artery and the right subclavian artery. However, on the left common carotid artery and the left subclavian arteries are direct branches of the arch of the aorta. That is the difference. I repeat, the right common carotid artery and the right subclavian artery are branches of the brachiocephalic artery, which is a direct branch of the arch of the aorta. However, on the left, the common carotid and the subclavian, for them they come directly from the arch of the aorta. Now, when you look at the two common carotids, the right common carotid and the left common carotid, they ascend to the neck. They ascend to the neck. And when they reach the carotid triangle, they divide. The common carotid arteries divide into the external carotid artery and the internal carotid artery. External carotid artery and internal carotid artery. Then the two internal carotid arteries are going to pass through the carotid canal. The carotid canal is within the skull bone. That's why I told you to come and look at the skull. They are going to pass through the carotid canal and they enter the cranial cavity, where they are going to begin giving off branches to the brain. On the other hand, the two subclavian arteries are going to give off a branch known as the vertebral artery. The vertebral artery. So the two vertebral arteries, these two vertebral arteries, are going to pass through the transverse foramen of the cervical vertebrae. They pass through the transverse foramen of the cervical vertebrae until they reach the foramen magnum, through which they will enter the cranial cavity. So for the two vertebral arteries, they enter the cranial cavity through the foramen magnum. And then they will begin giving off branches which are going to supply the brain, the spinal cord. So we have looked at two blood vessels which enter the cranial cavity to give their supply to the brain. The internal carotid, which passes through the carotid canal, and the two vertebral arteries, which pass through the foramen magnum, and then they will access the cranial cavity. This is the coronal section of the brain, and you're going to see that inferior to the brain. These blood vessels, when they enter the cranial cavity, they first reach the inferior surface of the brain. So if you want to see these blood vessels and the branches they give off, you go to the inferior surface of the brain, where you're going to see the 2 internal carotids and the 2 vertebral arteries and the branches they give off. So we have seen how this blood moves from the arch of the aorta and enters the cranial cavity through the internal carotid arteries and then the vertebral arteries. Now we are going to turn the brain upside down to look at the inferior surface of the brain to see when these blood vessels enter the cranial cavity and go to the inferior surface of the brain, how do they branch? This is the same illustration showing us the 2 vertebral arteries and the 2 internal carotid arteries. And then when they reach the inferior surface of the brain, they form an anastomosis. When they reach the inferior surface of the brain, they form an anastomosis, which is known as the circle of Willis. So this is the inferior surface of the brain. This is the inferior surface of the brain. We are seeing the 2 vertebral arteries which entered through the foramen magnum, and then we are seeing the 2 internal carotid arteries which entered through the carotid canal. And then we only want to see their branches and their anastomosis. We go to the inferior surface of the brain and study them extensively. So, what branches do they give off? We saw these 2 internal carotid arteries. Now we are looking at the inferior surface of the brain. We are here because this is the brainstem, midbrain, pons, and medulla. So we are on the inferior surface of the brain. We are there. You can see our midbrain, our pons, and our medulla oblongata. This is the junction between the pons and the medulla oblongata, and around there we have the junction between the pons and then the midbrain. So this is the same thing we are having. We are having the midbrain, the pons, and the medulla. So in other words, we have removed this portion which can be visualized on the inferior surface of the brain and brought it here. Now, these are the 2 vertebral arteries which enter the cranial cavity through the foramen magnum. And they are moving on the lateral aspect of the medulla oblongata. This is the medulla oblongata. You can see the cranial nerves which are coming out from it. Now, these 2 vertebral arteries are going to give off the posterior inferior cerebellar artery. The name suggests where the artery supplies. The common word is the inferior cerebellum. Inferior cerebellum. It means that it supplies the inferior surface of the cerebellum. That is why they call it inferior cerebellum. It supplies the inferior surface of the cerebellum. But the inferior surface of the cerebellum is divided into the posterior portion and an anterior portion. So when they call it posterior inferior cerebellar artery, it means that it supplies the posterior part of the inferior surface of the cerebellum. So these 2 vertebral arteries, when they are still moving along the medulla oblongata, they give off the posterior inferior cerebellar arteries. These posterior inferior cerebellar arteries are going to supply the posterior part of the inferior surface of the cerebellum, and they are also going to give off branches to the spinal cord, which is known as the dorsal spinal arteries. Now I want to make a point here. Sometimes these dorsal spinal arteries are direct branches of the vertebra. Sometimes. and sometimes they are branches from the posterior inferior cerebellum. So in this case, we are seeing the posterior inferior cerebellum, which is going to supply the posterior part of the inferior surface of the cerebellum, also giving off the dorsal spinal. Dorsal means posterior, spinal means spinal cord, so it's going to supply the posterior aspect of the spinal cord and the medulla oblongata. The vertebral arteries will continue to ascend, and as they are ascending, they give off two branches anteriorly. These two branches meet at this median sulcus, which separates the two medullary pyramids. These are medullary pyramids. So these two branches will come and then they will meet at the median fissure. And then when they meet, they are going to form what you call the ventral. You can replace the word ventral with anterior. Ventral spinal artery. The ventral spinal artery is going to supply the anterior aspect of the medulla oblongata and spinal cord, and the posterior part of the medulla oblongata and the spinal cord will be supplied by these dorsal or posterior spinal arteries. So we have seen our vertebral arteries giving off the posterior inferior cerebellum, the anterior spinal arteries. When the vertebral arteries reach the pontomedullary junction, the junction between the pons and the medulla, they join. When they join, they form what we call the basilar artery. And this basilar artery moves along the anterior surface of the pons. That is why when we are looking at the brainstem, we saw that the anterior surface of the pons has what we call a basilar groove, the groove where the basilar artery moves. It's because when the two vertebral arteries reach the pontomedullary junction, the junction between the pons and the medulla, they join to form the basilar artery, which moves along the anterior surface of the pons. What are the branches of the basilar artery? The first branch is the anterior inferior cerebellar artery. Remember here what the posterior inferior cerebellum. Both these arteries supplies the inferior surface of the cerebellum. This one supplies the anterior portion of the inferior surface of the cerebellum, and this one supplies the posterior portion of the inferior surface of the cerebellum. So this is the counterpart, the anterior inferior cerebellar artery. It's the first branch. Then the basilar artery gives off what you call the labyrinthine artery. Whenever they talk about the labyrinth, they're talking about the inner ear. And if this artery is blocked, the inner ear will begin degenerating, the tissue of the inner ear, and you lose balance. So this is the artery which is going to the inner ear, known as the labyrinthine artery. So it's a branch of the basilar. Then we are going to have branches to the pons. Some of the all these branches which are supplying the pons are known as pontine arteries. Some of them are long because they go and also supply the posterior surface of the pons. That's why they call them circumferential pontine arteries, because they are long and they can reach the posterior surface of the pons. That's why they call them the circumferential pontine arteries. Others are short. They call them paramedian pontine arteries because they only end at the anterior surface of the pons. But all of them are pontine arteries. The circumferential and the paramedian, all of them are pontine arteries, and they are supplying the pons. Then the basilar artery gives off another branch known as the superior cerebellar artery. This is simple. The name suggests where it supplies. The superior cerebellar artery supplies the superior surface of the cerebellum. That's why they call it the superior cerebellar artery. And in our specimens, we have some of these blood vessels. When we come, we shall look at them. After giving off the superior cerebellar artery, the pontine or the basilar artery will finally bifurcate. It will finally bifurcate in the region of the midbrain, and its final bifurcation, it gives off these posterior cerebral arteries. So the basilar artery finally terminates by bifurcating into the posterior cerebral arteries. When you look at the name posterior cerebral, which lobe of the cerebrum do these blood vessels supply? I need someone to answer. When they say that this is the posterior cerebral artery, which lobe of the cerebrum do these blood vessels supply?
Occipital lobe.
They supply the occipital lobe. They supply the occipital lobe of the cerebrum. But they also give off branches to the midbrain, which we shall see, and also what we call a posterior choroidal artery, which will also go to supply regions around the eye, but mainly supplying the posterior aspect of the cerebrum. That's why they call them posterior cerebral artery, where you find the occipital lobe. That is how blood which came into the vertebral arteries terminates. What about the branch which came in through the internal carotid arteries? The internal carotid arteries, when they reach the cranial cavity, they are going to give off a small branch known as the ophthalmic artery, which is going to go to the orbits to supply structures of the orbit, the ophthalmic artery. Then the internal carotids are going to give off what we call the middle cerebral artery. Then they will give off what we call the anterior cerebral artery. And then they will give off what we call the posterior communicating artery. The branches of the internal carotids are ophthalmic artery, middle cerebral artery, anterior cerebral artery, and posterior communicating artery. The posterior communicating artery is a very important anastomosis because it connects the internal carotid with the posterior cerebral artery in such a way that if the basilar artery or the vertebral arteries are blocked, blood may not reach these other parts, but it will come in through the internal carotid, posterior communicating, and compensate. And that is why this posterior communicating artery is a very important anastomosis. Now, the middle cerebral artery is going to go to the lateral aspect of the cerebral hemisphere. It is going to go to the lateral aspect of the cerebral hemisphere to supply the lateral aspect of the cerebral hemisphere. Around there, we have part of the frontal lobe, part of the parietal lobe, part of the temporal lobe. So it is the middle cerebral is going to go and supply the lateral aspect of the cerebral hemisphere. The anterior cerebral artery is going to go and supply the medial aspect of the hemisphere. When we made the sagittal section, we saw the medial aspect of the hemisphere. So this is going to supply the anterior portion of the medial aspect of the cerebral hemisphere minus the occipital lobe. And we are going to see images showing us those regions supplied by these blood vessels. The two anterior cerebral arteries are joined together by an important anastomosis known as the anterior communicating artery. If this internal carotid artery is blocked, blood can come in through this side, anterior communicating, and then compensate on this side. Hence, the circle of Willis is this. And it is in the region of the midbrain because this is our pons, this is our medulla oblongata, this is our pons, and this is the midbrain. And then we are seeing our circle of Willis here. Which blood vessels form the circle of Willis? We have the posterior communicating artery, the anterior cerebral artery, the anterior communicating artery, Then we come back to the anterior cerebral artery, posterior communicating artery, and then the two posterior cerebral arteries. And these ones are the ones which form that important anastomosis known as the circle of Willis. This is the circle of Willis. So here we are looking at the medial aspect of the hemisphere in sagittal section. The medial aspect of the cerebral hemisphere in sagittal section. And we are going to look at the anterior cerebral arteries. So the anterior cerebral arteries are these ones. They come and curve above the corpus callosum. They supply this medial aspect of the cerebral hemisphere up to the parietal occipital sulcus. So the anterior cerebral artery supplies the medial aspect of the frontal lobe and the medial aspect of the parietal lobe. And it ends at the parietal occipital sulcus. Then the medial aspect of the occipital lobe and the medial aspect of the temporal lobe are supplied by the posterior cerebral arteries. So this is the posterior cerebral artery. We saw it here, the posterior cerebral artery, this one. It is going to go and supplies the medial aspect of the temporal lobe and the medial aspect of the occipital lobe. And the anterior cerebral artery, this one, is the one which is going to supply the medial aspect of the frontal lobe and the medial aspect of the parietal lobe. It gives off those branches that is as it is curving above the corpus callosum. So this is how the medial aspect of the cerebral hemisphere is supplied with blood. What about the lateral aspect? Now, this anterior cerebral artery, is going to send branches to supply a narrow strip on the lateral aspect of the hemisphere. Let us see. Now, these are the branches. These branches you see there are going to go and supply a narrow strip on the lateral aspect of the hemisphere. And these are the ones. So these are the spillover branches of the anterior cerebral artery. After it has supplies the medial aspect of the frontal lobe and the parietal lobe, it sends spillover branches which are going to supply a narrow strip on the superior aspect of the lateral aspect of the hemisphere. These are the branches of the anterior cerebral arteries which are spilling over. Still on the lateral aspect, the occipital lobe will still be under the supply of the posterior cerebral artery. When you look at this posterior cerebral artery, it also sends spillover branches to the lateral aspect of the hemisphere, which we are seeing here, supplying the occipital lobe. In other words, the entire occipital lobe, both on the medial and on the lateral, is supplied by the posterior cerebral artery. Now, the posterior cerebral artery supplies the medial aspect of the temporal lobe. It supplies the medial aspect of the temporal lobe and also sends spillover branches, which we are seeing here, which supplies the inferior gyrus of the temporal lobe. So the posterior cerebral artery supplies the entire of the medial surface of the temporal lobe, and then it goes on the lateral aspect, sends branches on the lateral aspect of the hemisphere to supply the inferior gyrus of the temporal lobe. The rest of the lateral aspect, which is not supplied by the spillover branches of the anterior cerebral artery and the spillover branches of the posterior cerebral artery, the rest of the lateral aspect of the hemisphere, which is not supplied by these two, is the one which is supplied by the middle cerebral artery. And the middle cerebral artery, we saw it is this one. So the rest of the lateral aspect of the hemisphere, cerebral hemisphere, is the one which is supplied by the middle cerebral artery. So we can know the areas here We have the prefrontal cortex. You can see supplied by these spillover branches of the anterior cerebral artery. We have the motor areas here supplied by the middle cerebral artery. We have these auditory areas supplied by the middle cerebral artery. We have the visual areas supplied by the posterior cerebral arteries. So we have seen how the three cerebral arteries, the anterior cerebral artery, the posterior cerebral artery, and the middle cerebral artery, they call them cerebral arteries because they're supplying the cerebrum, and we have seen how they supply the medial and lateral surface of the cerebral hemisphere. This is another illustration of what I have been talking about. Remember, we saw that the two vertebral arteries give off branches which meet at the median sulcus of the medulla oblongata to form the anterior spinal artery. And they call it the anterior spinal artery because it's going to descend down on the anterior surface of the spinal cord, supplying it. That's why they call it anterior spinal arteries. But when these anterior spinal arteries are descending down on the anterior surface of the spinal cord, it is getting compensatory branches from the intercostals and then the spine. We have the cervical spinal arteries supplementing the anterior spinal artery in the neck region of the spinal cord. And then we have these intercostal arteries also supplementing the anterior spinal artery within the thoracic portion of the spinal cord. And then the lumbar spinal arteries also supplement the anterior spinal arteries when they are supplying the lumbar portion of the spinal cord. So this anterior spinal artery, much as it supplies the anterior part of the spinal cord, it gets compensatory branches from these other arteries, which are the segmental arteries. Then we saw on the posterior aspect of the medulla oblongata and the spinal cord, the posterior spinal arteries, which were branches of the posterior inferior cerebellar artery. There were two, one on the right, the other one on the left. These two posterior spinal arteries are the ones which are going to supply the posterior surface of the spinal cord and the medulla oblongata, of course getting compensatory branches from the neck and from the thorax and from the lumbar region. That is how the spinal cord is supplied. Anterior spinal, posterior spinal arteries, there are two. They are getting compensatory branches from these segmental arteries. So we can see the anterior, this is the cross section through the spinal cord. And you can see the anterior spinal is one, but the posterior spinals are two, one on the left, the other one on the right. They give off branches which penetrate deep into the substance of the spinal cord, and then they will supply the bundles or the tracts within the spinal cord. The anterior spinal contributing to supplying the anterior portion of the spinal cord, and the posterior spinal contributing to supplying the posterior portion of the spinal cord. And these are the compensatory branches which are also supplementing them. So that the spinal cord is at all times supplied with blood. That is the blood supply of the brain. Now, this is almost a three-dimensional image of the dura mater folds. This fold of dura mater, which is between the cerebral hemispheres, it lies in the median longitudinal fissure. This fold of dura mater is the falx cerebri. It is sagittal. It is between the two cerebral hemispheres. It's known as the falx cerebri. It meets a horizontal fold of dura mater. This horizontal fold of dura mater is known as the Tentorium cerebelli. So the Falx cerebri meets the transverse Tentorium cerebelli at right angles, at a right angle. Now, above this Tentorium cerebelli, we have the occipital lobe of the cerebrum, and below it we have the cerebellum. So the thing which separates the occipital lobe, the dura mater fold, or the dural fold, which separates the occipital lobe from the cerebellum, is this Tentorium cerebelli, which runs transversely. It is met by the Falx cerebri, which runs sagittally. So these folds of dura mater, for example, this Falx cerebri, this is a Falx cerebri. Its anterior aspect has a channel. This channel, its walls are made up of dura mater. So there is a channel which contains blood on the superior aspect of the Falx cerebri. So those channels which contain blood and they are made up of dura mater are known as dural venous sinuses. Whenever they talk about dural venous sinuses, they refer to channels made up of dura mater, but they contain deoxygenated blood. So, on the superior extremity of the Falx cerebri, you have a channel known as the superior sagittal sinus. It contains venous blood. And on the inferior edge of the Falx cerebri, we have another channel containing venous blood known as the inferior sagittal sinus. Then at the junction of the Falx cerebri, at the junctions of the Falx cerebri and the tentorium, we have another channel containing venous blood known as the straight sinus. What is the difference between sinuses and veins? The difference between sinuses and veins is that sinuses, the walls of sinuses are made up of dura mater. The walls of sinuses are made up of dura mater, whereas the walls of the veins are made up of smooth muscle. The walls of the durovenous sinuses are made up of dura mater, and the walls of the veins are made up of smooth muscle. That's the difference. The similarity is that both of them contain venous blood. So, this is the Falx cerebri. In its upper extremity, there is a channel containing venous blood whose walls are made up of dura mater, and this is what we call the superior sagittal sinus. So whenever I talk about durovenous sinuses, I'm talking about channels containing venous blood whose walls are made up of dura mater. And this one is what we call the superior sagittal sinus. On the lower extremities of on the inferior edge of the Falx cerebri, you have another sinus known as the inferior sagittal sinus. So this is what we call a superior sagittal sinus, and then this is what we call the inferior sagittal sinus. And I said that at the junction of the Falx cerebri and the Tentorium cerebelli, we have another one which is known as the straight sinus. So you can see that the venous blood in the inferior sagittal sinus is going to drain posteriorly into the straight sinus. And the straight sinus is going to come posteriorly in the region of the occiput to confluence with the superior sagittal sinus at this point. So this point where the straight sinus confluences with the superior sagittal sinus is what we call the confluence of sinuses. The confluence of sinuses. Then we have another sinus moving from the inferior aspect in the midline portion of the occipital bone. This sinus is very important. The veins which are within the vertebral canal forming the internal vertebral plexus, some of them drain their blood into this sinus known as the occipital sinus. So this is the occipital sinus. The occipital sinus is found in this fold of dura mater because above here we have the occipital lobe, below here we have the cerebellum. So the boundary between the occipital lobe and the cerebellum is the Tentorium cerebelli, within which you find the straight sinus. Then this occipital sinus is formed within a dural fold known as the Falx cerebelli. Now, the Falx cerebelli is a dural matter fold which separates the two cerebellar hemispheres. So between the two cerebellar hemispheres, there is a fold of dural matter known as the Falx cerebelli. This is the Falx cerebri between the two cerebral hemispheres, and this is the Falx cerebelli between the two cerebellar hemispheres. So within the Falx cerebelli, there is another sinus known as the occipital sinus, which also connects to the confluence of sinuses. So what dural venous sinuses meet at the confluence of sinuses? We have the superior sagittal sinus, we have the straight sinus, and we have the occipital sinus. They all meet at the confluence of sinuses. Then they pour their blood, they bring their blood to the confluence of sinuses. How is this blood taken away from the confluence of sinuses? If blood from the straight sinus comes and drains to the confluence, blood from the superior sagittal sinus also drains to the confluence. Then blood from the occipital sinus also drains to the confluence. How is this blood taken out? This blood is taken out by what you call the transverse sinuses, one on the right, another one on the left, because they move transversely. So these transverse sinuses will take that blood away from the confluence of sinuses. They will form what you call a sigmoid sinus, which is this curve, and then this sigmoid sinus will take that blood to the internal jugular vein. You can only appreciate these dural venous sinuses in sagittal section, and there are others which I'm going to show you which I have not talked about. But so far we have seen the superior sagittal sinus running through the superior edge of the falx cerebri, the inferior sagittal sinus running through the inferior edge of the falx cerebri, the straight sinus running through the midline portion of the tentorium cerebelli, the occipital sinus, which is running through the falx cerebelli, all meeting at the confluence of sinuses, and then the two transverse sinuses, one on the right, one on the left, will take away that blood from the confluence of sinuses. Now, these dural venous sinuses, where does the venous blood contained within them come from? The brain has veins known as cerebral veins. For example, here we have what you call superficial cerebral veins. These are what we call superficial cerebral veins from the surface of the cerebrum. Then there is what we call the superficial middle cerebral vein, which is very long. Superficial middle cerebral vein, which will go on receiving tributaries from the surface of the brain. All these are cerebral veins. So the superior sagittal sinus receives blood from the superficial cerebral veins, which are draining the brain directly. Then there is what we call the superior anastomosing vein, which connects the superior sagittal sinus and then the superficial middle cerebral vein. Then the superficial middle cerebral vein also takes its blood and drains it into the superior sagittal sinus. So the superficial cerebral vein, the superior anastomosing vein, and the superficial middle cerebral vein, all of them drain the brain and pour their blood into the superior sagittal sinus. The superior sagittal sinus continues to receive other cerebral veins, and that is where its blood comes from. So it is the veins whose walls are made up of smooth muscles, which drain the brain tissue directly, that pour their blood into the dural venous sinuses. And around this point, we saw that we had the confluence of sinuses, and then the transverse sinus is going to take away that blood from the confluence of sinuses. We have a transverse sinus on the right and on the left. They are the ones which pick the blood from the confluence of sinuses. Then they are going to form what we call the sigmoid sinuses, and the sigmoid sinuses at the jugular foramen, they are going to continue with the internal jugular vein, and then they will take out that blood. You must have a continuous visualization of these images so that you can grasp the anatomy of this venous drainage. We have a vein which connects the superficial middle cerebral vein to the transverse sinus, which is known as the inferior anastomosing vein. And then this vein, the superior anastomosing vein, connects the superficial middle cerebral vein to the superior sagittal sinus. So the other sinuses we did not see are these ones. For example, we have seen the superior sagittal sinus, the inferior sagittal sinus, which drains into the straight sinus. We saw the occipital sinus, which also comes and meets at the confluence of sinuses. So the straight sinus, the superior sagittal sinus, and occipital sinus are the ones which confluence at the confluence of sinuses. And the two transverse sinuses, the right and the left, will pick that blood from the confluence of sinuses. When they reach the temporal bone, they form what we call a sigmoid sinus, and the sigmoid sinus at the jugular foramen is going to continue with the internal jugular vein, and the internal jugular vein will return that blood to the heart. What forms the straight sinus? The inferior sagittal sinus. This is the inferior sagittal sinus running through the inferior edge of the falx cerebri, confluences with what we call the great cerebral vein. This is the great cerebral vein. This one drains the deeper structures of the cerebrum. So this is what we call the great cerebral vein. Some texts call it the great cerebral vein of Galen. So the superior sagittal sinus confluences with the great cerebral vein to form the straight sinus. So we are having the superior sagittal sinus, the inferior sagittal sinus confluencing with the great cerebral vein of Galen to form the straight sinus. We have the occipital sinus. This occipital sinus is continuous with the internal vertebral plexus of veins. So that is the occipital sinus. And then the two transverse sinuses, which take away the blood from the confluence of sinuses, then they form the sigmoid sinuses, and the sigmoid sinuses are going to join the jugular vein at the jugular foramen. This region is known as the hypophyseal fossa or the sella turcica on the superior aspect of the sphenoid bone. This is where the pituitary gland sits. This is where the pituitary gland sits. On the lateral aspect of the pituitary gland, we have two sinuses. On the lateral aspect of the pituitary gland, we have two sinuses. And these sinuses are the ones what we call the cavernous sinuses. It's the cavernous sinus on the right, it's the cavernous sinus on the left, and they are on the lateral aspect of the sella turcica or hypophyseal fossa, where the pituitary gland sits. And I say that whenever I mention about the word sinus, when I'm talking about venous drainage of the brain, I'm talking about folds of dura mater, which form channels or cavities containing venous blood. So these two cavernous sinuses, one on the right, one on the left, communicate with each other. You can see they communicate with each other, and these two communications are known as intercavernous sinuses because they connect the two cavernous sinuses. Then posteriorly, these cavernous sinuses, posteriorly, they communicate with the transverse sinus and the sigmoid sinus. The communication between the cavernous sinus and the transverse sinus, this communication is known as the superior petrosal sinus. The superior petrosal sinus connects the cavernous sinus to the transverse sinus. Then the inferior petrosal sinus connects the cavernous sinus to the sigmoid sinus. So these two cavernous sinuses communicate posteriorly with the transverse sinus and the sigmoid sinus through the superior petrosal sinus and the inferior petrosal sinuses, respectively. Now, there is another sinus here. It is between the sphenoid bone and the parietal bone. This sinus is known as the sphenoparietal sinus because it's between the sphenoid bone and the occipital bone. They call it the sphenoparietal sinus. So this phenopaidetal sinus moves along the posterior margin of the greater wing of the sphenoid bone, and it is going to drain into the cavernous sinus. It is known as the sphenoparietal sinus. Let's continue. So in sagittal section, as I told you, we have seen the superior sagittal sinus receiving these veins, which moves up to the confluence of sinuses. Then we are seeing the inferior sagittal sinus, which confluences with the to form the straight sinus, which moves through the tentorium. You need to understand this blood supply. It is not something, we are not studying the parts of the insect, head, thorax, and abdomen. You need to understand how these sinuses interconnect. It is not something you're going to enter the class and begin dosing, and after dosing, you just cram. Someone tell me, what is the name of this sinus?
Superior sagittal sinus.
Another person, what is the name of this sinus?
Inferior cerebral sinus.
Is the inferior sagittal sinus.
Why is the other person saying cerebral sinus? Because you're reading these names, you don't even know where the sinus is. Which is this vein which confluences with the inferior sagittal sinus? What is this name?
Right cerebral vein of Galen.
What do they form?
They form a straight sinus.
Where are the rest of the members? What is this sinus which is continuous with the internal vertebral plexus?
The sigmoid sinus.
This internal vertebral plexus goes up to the pelvis. Cancer cells can move from the pelvis and they move along this internal vertebral plexus, and then they spread to the brain through the occipital sinus and cause tumors within the brain. And some people will forget that because this internal vertebral plexus moves up to the pelvic region, if you have disease like cancer cells or any disease of the pelvic region, it can ascend through the internal vertebral plexus, and then it can communicate with the occipital sinus, and then that disease can spread to the brain. What is the name of this sinus which takes away blood from the confluence of sinus? There are two, one on the right, the other one on the left. What are their names?
Transverse sinus.
And when they reach the temporal bone, what do they form?
They form the sigmoid sinus.
And then what does the sigmoid sinus communicate with? In this opening, what is this opening?
The cavernous sinus.
The sigmoid sinus there is an opening here. What is the name of that opening? I've been talking about this opening. The sigmoid sinus communicates with a certain vein through this opening. What is the name of this opening? Okay, I will not tell you. What did we say about this sinus? What is the name of this sinus?
Cavernous sinus.
How many cavernous sinuses do we have?
Two.
Two.
Where are they located?
In the hypophyseal fossa,
At the sides of the hypophyseal fossa.
On the lateral aspects of the hypophyseal fossa. And I told you that posteriorly, they communicate with a transverse sinus and a sigmoid sinus. What are these communications? What is the communication between the cavernous sinus and the transverse sinus?
Intercavernous sinuses.
What is the communication between the cavernous sinus and
the
the
superior
transverse
petroso,
sinus?
superior petroso and inferior petroso
I say,
sinus.
what is the communication between the cavernous sinus and the transverse sinus? This one. And then there's another one between the cavernous sinus and the sigmoid sinus. So what do they call this? And what do they call this?
Superior petroso sinus.
And this one?
Inferior petroso sinus.
Now, some of you are keeping quiet. And I'm going to make sure that I examine these sinuses extensively. So at the moment you think that you shouldn't pay attention, but you'll be forced to pay attention at the right time. Remember, this is the last course you do before you enter the skills lab. Once you fail it, you will not progress. So those of you who are still playing games, continue playing games. When we are teaching, you must pay attention. These sinuses, I've talked about them. Here you're seeing the internal vertebral plexus communicating with the occipital sinus. And I told you infections can move from the pelvis through this internal vertebral plexus to the brain because it communicates with the occipital sinus. Anteriorly, it also communicates with the inferior petrosal sinus. You can see here. So anteriorly, let's look at this internal vertebral plexus, which moves on the inner aspect of the vertebral canal. Posteriorly, when it reaches the foramen magnum, it communicates with the occipital sinus. Anteriorly, it is going to communicate with another venous plexus known as the basilar plexus, and the basilar plexus is going to communicate with the inferior petrosal sinus. Are you seeing that? What are the cranial communications of the internal vertebral plexus? Posteriorly, the occipital sinus. Anteriorly, the basilar plexus of veins, and the basilar plexus of veins communicates with the inferior petrosal sinus. So there's a communication between the internal vertebral plexus, which moves all the way from the pelvis to the cranial cavity, anteriorly and posteriorly. Hope you are seeing that. Are you seeing that?
Yes, sir.
Yeah.
Yes, sir.
This is a cavernous sinus. When you make a sagittal section, you only see one, but at the back of your mind, you have one on the left, and the other side, you have another one. What are the communications of the cavernous sinus? Posteriorly, what are the posterior communications of the cavernous sinus? We have talked about them. What are they?
Posteriorly, what?
I talked about the posterior communications of the cavernous sinus, both on the right and on the left. What are they?
The superior petrosal sinus and the inferior petrosal sinus.
The superior petrosal sinus and the inferior petrosal sinus, where the superior petrosal sinus communicates with the transverse sinus and the inferior petrosal sinus communicates with the sigmoid sinus. These sinuses, remember, they contain venous blood, and the cerebral veins are the ones which drain there. Now, what does the cavernous sinus communicate with inferiorly? This is the inferior communication. What does it communicate with inferiorly? You do not see. What is this? Members, are you hearing me? This is the cavernous sinus. Below it communicates with another venous plexus. What is its name?
It is the pterygoid venous plexus.
So this pterygoid venous plexus is the inferior communication of the cavernous sinus. And anteriorly, what does the cavernous sinus communicate with anteriorly?
Superior ophthalmic vein.
And what?
And the
Superior ophthalmic vein.
sinus.
Inferior ophthalmic vein. Inferior ophthalmic vein.
They communicate with the cavernous sinus anteriorly. And what does it communicate with inferiorly again?
Pterygoid venous plexus.
And what does it communicate with posteriorly?
Petroso, superior petroso and inferior petroso through the superior petroso to the transverse sinus, inferior petroso to the sigmoid sinus,
The
and
internal
then
vertebral plexus.
internal vertebral
I
plexus.
want another person to answer. I want another person. The vertebral plexus, what does it communicate with? The internal vertebral plexus, what does it communicate with posteriorly?
Occipital sinus.
And what does it communicate with anteriorly? What does it communicate with anteriorly?
It is the basilar plexus.
Because this part of the sphenoid bone is known as the basilar process. So this is the basilar plexus. And what does the basilar plexus communicate with in turn?
The transverse.
Inferior
Inferior
petrous
sinus.
This vein is known as the supraorbital vein because it is above the orbit, deep to skin of the face. And this vein is known as the facial vein. So you can see the supraorbital vein and the facial vein anastomosing. These are veins of the face. When you have an infection in the face area, when you have, are you hearing me, members?
Yes.
Yes, sir.
You have infections in the face area. Those infections are going to enter the facial vein. And when they enter the facial vein, they are going to move through the superior ophthalmic vein and inferior ophthalmic vein and reach the cavernous sinus. And when they reach the cavernous sinus, they are going to form what you call cavernous sinus thrombosis. Cavernous sinus thrombosis. They are going to coagulate and form the cavernous sinus thrombosis. And then from the cavernous sinus, they can be transmitted throughout the entire brain because the cavernous sinus has communications with the venous sinuses. So infections of the face can enter the cavernous sinus and cause what we call cavernous sinus thrombosis. And I want you to go and read about the cavernous sinus thrombosis. So at the end of the day, that blood is going to enter the internal jugular, and the internal jugular is going to take it to the brain. The rest can enter the facial vein, and the facial vein will also, in the end, join the internal jugular. You must know the dural venous sinuses and their communications. These are the superficial veins which drain into the superior sagittal sinus and then the transverse sinus. You can see this. This is an MRI image. You can see the superior sagittal sinus. You can see the straight sinus and the vein of Galen. You can see the transverse sinus, the sigmoid sinus, and you can see the internal jugular vein. You can see the anastomosing vein, the inferior anastomosing vein, which we talked about. And you can see the cavernous sinus around there, communicating through the inferior petrosal sinus to the sigmoid and the superior petrosal sinus to the internal jugular. These are the kind of images that I bring in an exam. And you can see the inferior sagittal sinus. So if your anatomy of these dural sinuses is poor, you're going to face it rough. These are the cerebral veins, the superficial cerebral veins, which are draining into the superior sagittal sinus. And around there, you're likely to have the occipital sinus. So take these images seriously. You can see the superior sagittal sinus, the inferior sagittal sinus. This is the inferior sagittal sinus. This is the vein of Galen, the straight sinus. Can see the superior sagittal sinus, the confluence of sinus, and a little bit of the occipital sinus there. The cavernous sinus is around here. So I've given you these images, and you have to look at more of these images so that you can identify the dural venous sinus.